Okay. Welcome to the Experience Better video podcast series. I'm Josh Fiekler, and I'm joined today by Jenny Eberly of Grand Island Physical Therapy. And today we're going to talk about cupping. So tell us, Jenny, what is cupping?
So cupping is a form of massage that was developed by the Chinese. I think Michael Phelps is one that made it
that's
very
the first
popular.
thing I thought of. Yep.
Yeah, because everyone was wondering what the heck were there circles all over his back when he was in the Olympics.
Yeah.
That was cupping.
Gotcha.
We don't do the fire cupping like he had done.
Okay.
But we do a form of suction cupping.
Okay.
And there's two different types of cupping. There's static or just moving mobility wise.
Mm-hmm.
Static is good on trigger points or tight muscles.
Okay.
It relaxes it.
Mm-hmm.
When you have like myofascial or tight tissue everywhere, putting the cup on and moving it feels really good.
Okay.
A lot of people don't tolerate deep tissue massage.
Mm-hmm.
You know, they just don't like people digging on them.
Right.
This works wonderful for those
so this
people.
is like a gentler version of that.
Yes, exactly.
Okay.
It's a very nice, gentle version. Most people, if they can't handle massage, like this.
Very good, very good. So you see patients that you're going to do any type of soft tissue work with them, this generally is a good avenue or a good modality you can use as well.
Very good, yeah, because they tolerate this better.
Very good. Well, let's give it a try. I'll be your guinea pig here. And
so usually we just pick an area that has a tight muscle. We put the cup right over top, and we suck it to it. And so the big problem with this is people don't like bruises.
Mm-hmm.
It does create bruises. You will have circles, like
Right.
Michael Phelps did.
Right.
So I always warn patients about that. That's the worst thing that's going to happen with
Gotcha.
this, is you're going to have your nice circles bruises.
Mm-hmm.
We leave this on anywhere from 3 to 10 minutes, depending on how tight the tissue is,
Right.
and to get it relaxed.
Yeah, and I can feel the muscle like kind of being pulled, stretched a little bit, but it's not like super uncomfortable or anything.
It's not painful,
Right.
but I guess I describe it to anybody. Have you ever played with a vacuum as you're a kid?
Sure.
That's what it's like.
Yep.
When you suck the vacuum tube and you're playing.
Right. Yep.
So, but yeah, so it works wonderful to do that, and also, like I said, you can move them around a little bit and really pull that tissue.
Sure.
And get it to relax that way too.
Very cool. So you mentioned the fire. What's the difference between the fire cupping? What was that about?
So there's like 3 different types of cupping. There's where you squeeze them and put them on, and that's how they hold. The fire cupping, they actually stick a flame inside a glass cup.
Wow.
Take all the air out and put it on you.
And that's what he was doing.
That's what he was
doing. And you don't do that.
Well, obviously a flame in a clinic is probably not a good idea.
Probably a good idea.
Yes.
So, very cool.
But yeah, so this works wonderful just to work out areas, and especially if you just don't like deep tissue.
Yeah. Very good.
But as you can tell, we just pop them off.
Mm-hmm.
And Josh is going to have a little bruise there. Not much, but just a little.
It's pretty manly.
Yeah, there you go.
It doesn't bother me at all. So Jenny, you do a lot of different manual therapy modalities, whether it be cupping, whether it be dry needling, or you use Graston.
Mm-hmm.
How do you decide maybe which one you want to use? Is it kind of patient specific, or?
It is.
Yeah.
My instructor told me, more tools in your toolbox make you better.
Yeah.
I mean, that's what I look at.
Right.
So if I need to get down deep, the needling works wonderful.
Right.
If they want to do it quick, I go to the needling.
Sure.
Some people don't want needles and they want that deep tissue, so I go to the Graston.
Mm-hmm.
The Graston works better for tendon issues too versus muscle.
Yep.
And the cupping, like I said, if they don't want me to dig in, they're scared of needles, it's another alternative.
Right, right. So to kind of toot Jenny's horn a little bit, you're not going to find many therapists anywhere really who specialize in manual therapy like she does, who are certified and trained in all the different areas that she is. I'm able to use like dry needling in the Graston, but I can't do. I'm not trained in the cupping. So so Jenny really brings that a lot of different abilities to treat you to the table. So be sure if you're having any issues, soft tissue or otherwise, come see Jenny at Grand Island Physical Therapy. And thanks for joining us today. And you mentioned a mother's card earlier to me.
Yes.
I want to hear about this.
So when I was getting ready to go to my needling classes, you really have to relearn your anatomy well, because I was out of school a while. And my kids were giving me a hard time. They're like, Mom, what are you doing? They're like, why do you have sight words? Because I had flashcards out, and I was learning everything again. And so my 3rd grader at that time, he was told to do a Mother's Day card. And they told him to draw what his mom does. So he drew a person on a table with me with these big old, it looked like knives, but they were supposed to be needles, with me stabbing people. And I'm like, thank God your teacher knows who I am. So yeah, that was one of the first things my kids thought of, is just me stabbing people with needles.
Perfect. So yep. Well, out of the mouth of babes, right?
Yes, exactly.
All right. Well, thanks for joining us today, and tune in next time.